So puberty and changes and explaining to kids what's happening, and why do you go to gynecologists as opposed to a pediatrician?
So puberty is the process where in girls, in young girls, the ovaries suddenly start to produce these hormones. Okay, the ovaries are suddenly stimulated to begin to produce the same hormones that we've been mentioning, estrogen and progesterone. Now, the young lady is going to begin to notice some changes. Well, she's not going to begin to notice them, but anyone who is a keen observer is going to begin to notice some changes. And the first change that occurs in puberty, there are four of them. The first change that occurs, or the first secondary sexual characteristics, because that is what we refer to them as, is breast development, is something that we call telarc. She's going to begin to develop breast buds. If you look closely at the chest, you'll begin to notice that she's developing breasts. Now, that is usually the first thing that occurs. Secondly, after some time, she's going to begin to develop pubic hair. Okay, so the breast buds appear first, then pubic hair, and then she's going to have a small growth spurt. Okay, she's going to get a little taller. Okay, and finally, the menses is going to begin. The menstrual cycle is going to begin. So if we notice a little girl who is developing breasts, she's beginning to show some signs of secondary sexual characteristics. The breasts are beginning to develop. Her pubic hair is beginning to develop. She's getting a little taller, a little bigger. But there's no menstruation. We shouldn't be alarmed immediately. We shouldn't really be alarmed. Okay? She has up until age 16 for the menses to begin. If the menses does not begin by age 16, then we need to do some investigations. But if the young lady is 11 or 12, she's beginning to develop breasts, beginning to develop pubic hair, but there is a year or two delay in the beginning of the menstruation, in the menarche, then that's not an issue at all. Now, as a parent, once you begin to notice any signs of secondary sexual characteristics, that should possibly be or probably be the best time for you to sit down and have a frank discussion with the young lady. I think too many of our young girls, get caught by surprise with the menstruation. No one has told them that it's going to occur. No one has, informed them. They're not mentally prepared. They're suddenly playing one day and then they begin to bleed. And that's when they run to mom or, to somebody to say, well, I'm bleeding, what's happening? And there's quite a bit of distress. So if the young lady has begun to develop breasts, and you notice that there is some degree of breast development, then perhaps it is the best time to sit her down and have a discussion with her. This is what you're going through. You're developing secondary sexual characteristics. At some point in time, you're going to begin to have this type of bleeding that comes every month. This is called the menstruation. And then she will at least be mentally prepared for it. Okay.
Do you go to the gynecologist once it starts, or what? A pediatrician?
No. It's a natural process. It's a natural process that doesn't need any type of monitoring or any type of intervention. Okay, so once it starts, it's just to monitor. If she's having tremendous pain, if she's having quite a lot of pain, intense pain with her menstruation, you may consider seeing a gynecologist to figure out why she's having so much pain. But if it's just the typical crampy mild to moderate pain, crampy pain that most teens feel when they're having their menstrual cycle, then it shouldn't be cause for alarm. It's a natural process, and it's something that is going to occur. Okay.
Women's health. Why should you go to a gynecologist as opposed to, your general practitioner when you notice changes in your body, or even when you're doing a pap test?
Well, I wouldn't say that you necessarily have to go to a gynecologist to get a pap smear. Okay, anyone can do a pap smear as long as they know what they're doing. When I say anyone, I mean a general practitioner, right? And most of the pap smears that are done here in Antigua are done really by general practitioners, right? Or even by experienced nurses in the district clinics. Okay, so I wouldn't necessarily say that it is a must to go to a gynecologist. However, if there is a problem, okay, that needs to be resolved by a gynecologist, I find still that there are a number of problems that a lady may have, and they still visit their general practitioner, who may not be most adept at dealing with these problems. There is nothing wrong with that. If a lady suddenly gets up one day and starts to bleed, there is no problem with going to your GP. But your GP has to be someone who has the presence of mind to investigate your problem, and if it needs to be referred to a gynecologist, will make that referral. And sometimes that is what I find that is amiss here in Antigua, that there is a delay in referring the patient. So a patient may have, and I'll give an example, patient may go to a GP and complain, every time I have sex, I'm bleeding. That is something I would call postcoital bleeding. And that's a sign or a symptom that needs to be investigated, and it needs to be investigated urgently, because it could be a sign or the first sign that tells us, hey, there is some cancerous or precancerous process that is occurring on this lady's cervix. So you may find that the gynecologist, the GP, the general practitioner, sees this lady on multiple occasions for the same problem and does not refer her to a gynecologist. By the time they refer her, there's an advanced precancerous lesion there. Okay, so this is something that I'm saying. I don't have a problem with a lady visiting her general practitioner, and I would never say that she has to visit a gynecologist for certain problems. She could visit her general practitioner. However, if it's a problem that you notice that is gynecology related, it's you're having vaginal bleeding, you're having a vaginal discharge that just doesn't go away, you're having pelvic pain, you haven't seen your period for 3 months, and that perhaps you're not sexually active, you're not pregnant, it may be a hormonal problem. You notice that your belly is swelling, it's getting bigger and bigger and bigger, and you're exercising, you're in the gym, but you notice that your belly is still getting bigger and bigger. These are problems that you perhaps would benefit more from visiting your gynecologist as opposed to a GP.
And finally, this person is a 50-year-old person, and they're very active, I guess. Okay. In gym, etc. But they said they have joint pains, and how could they deal with that issue? And should they continue to use weights such as 10 pounds, or should they look to be increasing their weight in their exercise regime?
Well, any physiotherapist will tell you if you are having joint pain, then you probably shouldn't be putting weight on the joint. You probably shouldn't be putting weight on the muscle. Now, I'm not sure where the joint pain is. I'm not sure if the joint pain is just joint pain that just appears, sporadically, or if it is joint pain that the person knows is exacerbated by her exercise, because she claims that, she does some weight training and so on, some resistance training. If the joint pain is related to resistance training, then you probably need to, one, reduce the weight or eliminate the weight altogether. Now, if you're doing weights in the gym and you're having pain in your shoulders, and or repetitive pain in your shoulders or repetitive pain in your elbows, then perhaps the flexion and extension at the elbow with the weights is what is causing the joint pain. Perhaps the same thing at the shoulder is what is causing the joint pain. So you probably need to eliminate that. If it is joint pain that is just happening, perhaps if it's joint pain in the wrist or in the elbow, You may need to be assessed for some sort of arthritis, and there are myriad of types of arthritis. You may also need to be assessed for nerve compression, okay? Because in some cases, a nerve that's running through the joint may be compressed, may be irritated, and that may be the cause of the joint pain. So this is a patient that would have to be assessed so that we could, take a full history and then do a physical examination to determine what exactly is the issue.
Thank you very much, Dr. Ephraim. I really thoroughly enjoyed this interview.